Hi, I'm Dr. Lucy Hinder, and I research diabetic peripheral neuropathy in Dr. Feldman's lab. About half of all diabetics eventually develop peripheral neuropathy, and it's the most prevalent neurodegenerative disease in the US. But despite its prevalence, we actually don't have an effective therapy to treat neuropathy in type 2 diabetic patients. And this is largely because we don't understand the mechanisms underlying this nerve damage in type 2 diabetes. When type 2 diabetics control their blood glucose, their blood sugar, it doesn't really prevent the development or the progression of the disease, whereas in type 1 diabetes, it's more effective. So clearly there's a lot going on at the level of the nerves that we really don't understand in the setting of type 2 diabetes. So in order to really get at this mechanism, we turn to mouse models of disease, and we can recapitulate the type 2 diabetes and the peripheral nerve damage in diabetes. And over the past few years, we've shown that in response to the high glucose in their systems and the high blood fats in their systems, the peripheral nerves undergo a metabolic reprogramming. They don't increase the metabolism of the glucose, but they actually increase the metabolism of the lipids. But instead of using those lipids to really produce energy to drive the function of the nerves, the metabolic sinks get clogged, and the metabolites from the lipid metabolism get shunted off into lipotoxic pathways, so pathways that injure the nerves. And importantly, that metabolic reprogramming is more pronounced in the distal extremities of the nerves, exactly where the peripheral neuropathy presents in patients. But those experiments were performed on whole nerves, and the nerve is very complex. It has lots of different compartments, lots of different cell types. So what I'm really focused on now is understanding where that metabolic reprogramming is happening, when, and how we can really target that more precisely. Because if we can understand what's happening where and when, then perhaps we can develop therapies to really improve the life of patients.